The career we chose is speech-language pathology. A speech-language pathologist or speech pathologist is someone who works to assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders. Speech pathology is a field that works with people of all ages, from babies to adults. Whether it is helping a child who has a speech delay or helping a recovering older adult regain their speech after a stroke, speech pathologists have a wide range of skills that allow them to effectively treat patients. Not only do speech pathologists focus on one-on-one patient-provider relationships, but they also work collaboratively with professionals from many other disciplines in order to ensure full communication and the free flow of information about the patients. We chose this career because it widely relates to the concept of older adulthood and the aging process. As chronic illnesses have hugely impacted our aging population, speech pathology can be an important and very helpful intervention. Many chronic illnesses that develop can relate to communication, cognition, and swallowing, all of which are areas that a speech pathologist is specifically trained to assess, diagnose, and treat. Geriatric speech pathologists work with assessing particular areas of decline and illness in order to help improve the functioning and overall quality of life for older adults. As quality of life is an important topic that we have studied, we found it useful to choose a career that focuses on bettering the quality of life for older adults.
The field of speech pathology spawned in the United States in the early 20th century, its true beginning marked by the establishment of the American Academy of Speech Correction in 1926. However, it wasn't until the 1940s and the conclusion of World War II that significant resources were redirected towards study. At this time, thousands of war veterans were returning home, many of whom suffered brain injury that often manifested in speech complications. From the 60s to the 80s, there was a movement that integrated the study of linguistics, and thus the treatment of language disorders and delays, with speech pathology. Today, there is an abundance of research being done to further the advancement of the field, and the study of communication disorders is so well established that it is even offered as a major at some universities. In order to pursue a career in speech pathology, one must achieve a graduate degree in the study, complete a postgraduate supervised clinical fellowship, and pass the national licensing examination, the Praxis exam.
Speech pathologists have access to many resources and information on diverse perspectives because of increased national and international exchange of professional knowledge. This strengthens research collaboration and improves education in communication disorders. The global society is becoming more connected and integrated, which increases speech pathologists' professional knowledge. Global teletherapy is a growing practice that provides online speech therapy. Teletherapy sessions are similar to traditional speech therapy sessions, but instead of being in the same room, patients and therapists interact through live video conferencing. Global teletherapy is effective and affordable and can be tailored to the patient's specific needs. This type of care can connect speech pathologists to patients nationally and internationally. The overall objective of speech pathology is to optimize patients' ability to communicate and swallow to improve their quality of life. So an important concept in speech pathology is cultural competency. The U.S. population is becoming increasingly diverse. Speech pathologists should be committed to providing culturally appropriate services, and it is also important for them to consider scientific data and research on the diversity of human communication and swallowing. Another important concept in speech pathology is making decisions based on the best available evidence or using evidence-based practice. This ensures that current, high-quality research evidence is integrated with expertise in the patient's values and personal preferences. The continuity theory is important in speech pathology because treatment is provided to restore a patient's functional ability. This is important in allowing patients to continue to maintain the level of communication throughout their life. Optimizing a patient's ability to communicate and swallow can increase quality of life by allowing them to continue to have the same communication abilities.
So, as we've said, speech-language pathologists work with problems related to an individual's ability to speak and communicate properly. Some examples of problems that these people may be facing and getting treatment for include stutters or other speech disorders, trouble understanding or sharing language and thoughts, problems with verbal and nonverbal social communication, issues with attention or problem solving, and even difficulty swallowing. So the career may involve the direct diagnosis and treatment of these disorders, It may involve providing training to families or other professionals about speech disorders and the treatment of them, or even working collaboratively with other professionals, being an advocate for people facing speech problems. And some responsibilities of the job include assessments, planning treatments, providing support, reporting progress, maintaining records, and working alongside similar professions. And as far as the setting for the career, it really depends on what the individual is interested in. So they could work in a research facility, working on a project. They could work in a more educational setting, such as an elementary school, or in a healthcare facility, assisting those that have health issues as well as speech issues. And as far as advancements for the career, so there are a lot of options for speech-language pathologists, such as becoming a manager, becoming the head of a district department, owning a private practice, becoming a professor, or even getting a specialty certification for a field of interest.
The roles of nurses and speech pathologists impact one another, and interprofessional collaboration is essential. Speech pathologists impact patients' ability to communicate, and it is essential that nurses be informed as to the patient's capabilities and possible adjustments that should be made when interacting with the patient to ensure their communication needs are met, whether this be through assistive devices or different methods of communicating. Furthermore, speech pathologists work a lot with dysphagia or difficulty swallowing and may determine that a patient should have thickened liquids. A nurse must be aware of the liquid consistency status for a patient in order to ensure that the liquids a patient receives match their ability to swallow. These practices demonstrate how interprofessional collaboration between speech pathologists and nurses can lead to better patient outcomes through preventing aspiration pneumonia in patients who suffer from dysphagia. These types of interprofessional interactions can occur in a wide range of organizations, such as hospitals and skilled nursing facilities, and impact nursing care on an everyday basis. Speech-language pathologists play an important role in addressing issues of global aging. As the aging population grows in the coming years, healthcare workers are faced with an increased need to address the issues that older adults face. Speech pathologists play an important role in assisting older adults through differentiating between normal aging and disordered communication or swallowing function. Speech pathologists provide aid to older adults with communication, cognitive, and swallowing impairments. In older adults, vocal cords can become less elastic and the larynx muscles can weaken, which makes it more difficult to speak. Additionally, the incidence of stroke, dementia, and head, neck, or throat cancer grows in the older adult population, each of which are conditions that can lead to communication dysfunction and are addressed by the therapy provided by a speech pathologist. Strokes can sometimes lead to aphasia, which impairs one's ability to comprehend and properly use language. Speech pathologists help these individuals in their communication and cognitive skills through singing, constraint-induced therapy in which scenarios only with spoken words are created, visual speech perception, support groups with peers, diet and feeding modifications, and muscle retraining or compensation strategies to prevent muscle deterioration and rebuild strength. These therapies are also used in older adults with dementia to minimize cognitive decline and can be used in older adults with head, neck, or throat cancer, sometimes in combination with electric stimulation of the throat muscles to help these individuals maintain their capabilities within communication. Speech-language pathologists contribute to the issues of global aging by enhancing the abilities of the growing older adult population to communicate properly with others. Social justice refers to justice in terms of the distribution of wealth, opportunities, and privileges among society. Social justice issues faced by older adults include a lack of diversity within assisted living communities, a lack of access to quality healthcare services, stigmas associated with older adults' functionality, ageism, and a lack of secure income. Social justice also includes the right to work, social security, education, and family life. Achieving social justice is a right of all individuals within society, but this right may be compromised in individuals who are not able to communicate their wants and needs. Therefore, the assistance of speech pathologists allows older adults to maintain their ability to properly communicate with others
which allows older adults to act as their own advocates for both their health and opportunities within society. Older adults have a right within society to the same privileges as individuals of all other ages, and their ability to communicate is an essential component to older adults' feelings of belongingness and acknowledgement within society, as well as their ability to advocate for themselves within social justice. Speech-language pathologists also contribute to older adults' ability to maintain their careers through maintaining their communication capacity, which relates to social justice and allowing older adults the same opportunities within different careers as younger adults.